Hi everyone, my name is Kayla Fairbanks and I'm really excited to be able to talk to you today about ADHD, or the Attention Deficit Hyperactivity Disorder. I know a lot of you are probably really familiar with this disorder, and I was excited to be able to talk about it. A lot of my family members have been diagnosed with this, as well as I work at a school with a lot of kids who've been diagnosed with this disorder, and I work in a classroom with them, specifically reteaching them and helping them in their assignments. And so I'll probably talk a little bit about my experience with that. But we'll go ahead and jump into the diagnosis of this disorder. So it can be defined as a neurodevelopmental disorder characterized by persistent problems in sustaining attention and difficulty engaging in quiet activities for a prolonged period of time. When it's talking about neurodevelopmental, it's saying that it's a problem as kids are growing up in the nervous system. Um, and so they talk a lot of it has to do with kids. And the symptoms are usually noticed around 12 years old, even 7, but they can be detected as early as 3. And it's actually recognized faster in boys rather than in girls, which is interesting. But it is important to note that it is um, present in boys and girls, and it is also present in adults. So yes, it is a big deal for kids growing up, but it is also an adult problem. So some of the 3 main symptoms of ADHD. The first is inattention. It involves wandering off tasks, lacking persistence, and difficulty sustaining focus. Um, I'm sure you've probably seen this symptom at some point in your life, probably in school, or in your job, or just in someone that you know, or in yourself. I know I've seen it at work with the kids really struggling being persistent in things. With an assignment or listening to a lesson, they just cannot seem to stay focused on the task at hand. They can't stay focused on the speaker, on the words that they're hearing. Their mind is elsewhere. They're daydreaming. The next one is hyperactivity. A lot of people may refer to this when they use the term bouncing off the walls. It's excessive activity when it's inappropriate, especially in a classroom or even in a work setting, including excessive fidgeting and restlessness. So you see those fidget spinners and all the fidget toys, those are used a lot by people with ADHD because they're constantly fidgeting. They need to be moving, and it helps them to keep from jumping out of their seat when it's inappropriate. And there's impulsivity. That's taking actions without planning or thinking about what they're doing, including inability to delay gratification. So for example, if someone wants something now or they want to say something now, it doesn't matter that someone is in the way. It doesn't matter if it's an inappropriate time. They're going to do it no matter what. They're going to do it right now. And so that's another symptom that you can see when it comes to ADHD. So I'm going to kind of go through each of those symptoms and some of the thoughts and behaviors that go along with them. So for inattentiveness, it's when someone struggles to pay attention to details. They make careless mistakes because they're just not even, their brain's not even fully focused on what they're doing. And so they make mistakes because all of their attention is not on this one thing. When you speak to them, it may not even seem like they're listening. They may seem like they're off in la la land. They're daydreaming. Again, like I said earlier, they may have difficulty following directions because they can't, all the steps may be jumbled in their head and they struggle to do this step by step because they're kind of all over the place or they're not paying attention. They may avoid or dislike things that require continuous mental effort. I know at work, working with kids, if they have a specific assignment that requires them to sit there and go through each of these problems or fix mistakes, it's really a struggle for them to stay focused. I may tell them the directions 3 times and turn around and they haven't moved. Like they just lack the motivation to do it because it's just so hard for their brain to stay focused on this topic for that long. So you may be able to crank out an essay, but someone with inattentive symptoms of ADHD may really struggle to do that. They may be forgetful in daily activities, and because of these things, they may really struggle with their self-esteem, feeling like they can't focus, feeling like they're never going to get done what they need to. They may feel anxiety from all the things that they need to get done, and they don't have the mental, not capacity, but drive to be able to do so. So that's inattentiveness. Then hyperactiveness and impulsiveness, some of their thoughts and behaviors. Again, like I said before, fidgeting, just constantly needing to move, getting out of your seat when not asked, talking too much. They may not even realize it. Their brain's just jumping from one topic to the next. They may struggle to wait for their turn, constantly moving, blurting out answers. I see that at school all the time. They don't think things all the way through before acting. And so that just goes along with both. They may just be all over the place with just tons of energy, just do things without even thinking about them. And because of these things, they may feel really judged again or feel low self-esteem. Um, I see that at school again, and I've had family members who've struggled with that because people assume, and we'll get to that when we talk about misconceptions, but they just assume that they just are not a good student, they don't listen, or they don't think things through, they're not smart, and so they may feel really judged and frustrated with themselves. So why can't I just stay in my seat? Why can't I do this? It's because their brain is just it's just going crazy. So again, some of the misconceptions of this disorder, people assume that children with ADHD are just going through a stage with all of their energy or their impulsiveness or not being able to pay attention. They may think, oh, that's just how they are right now. They'll grow out of it. But in reality, we need to pay close attention to some of these symptoms and be careful not to just judge because we may miss an opportunity to help treat a disorder that they have and help them later in their life or throughout their life. People may think that they're just lazy or forgetful, that they just can't keep track of things and they just need to pay more attention and put more effort into things, which is not true. Their brain struggles to keep track of things. Things get lost. People may think they just have anxiety and that's why they're so fidgety. That's why they can't sit still. That's why they get stressed. Like I said before, again, people may assume that they're just not good at school, that they're not smart, which is not true. Their brain it takes some time to funnel their focus that's kind of all over the place into one topic or the task at hand. And so it's just difficult for them to stay on topic. So it does not at all mean that they're not smart or good at school. They could be very, very well super smart. It's just their brain struggling to stay focused. People may think that they're always hyperactive, but that is not always the case. Like I said at the beginning, people may assume that only boys have it and not girls just because it's harder to pick up symptoms in girls than it is boys. But boys and girls do have it. And the last is that kids grow out of it. Adults do have it, like I said. I have many family members who are adults that still struggle with ADHD greatly. And this disorder definitely needs treatment, and so we'll get into that. Some of the treatments of ADHD are pharmacotherapy. This is one form used, and it involves a group of drugs called psychostimulants. Those are commonly prescribed when going to a doctor to address your ADHD needs. You may wonder why in the world you would use a stimulant when you're already hyperactive. It's because as a stimulant, it provides your brain with the dopamine that it would get from doing all of the fidgeting, from your brain going from place to place. So it kind of counteracts that need the brain is asking for, and so it calms the brain down. The brain's like, okay, I have the dopamine. I don't need to jump out of my seat. I don't need to be fidgeting because I have what I need. So that is something that's very commonly used. It's broken down into two types, methylphenidates and dextroamphetamines. A large amount of people use a specific drug called Adderall, which you're probably familiar with that term. These are used to bring focus to people who suffer with ADHD and help them just, again, stay focused. They're actually really effective. They're used and they're effective in 70 to 90% of the patients that they're prescribed to. But there are also non-stimulant medications available either in addition to these prescribed medications or just be used on their own. And then there are behavioral treatments. Those are options for people as well. For a lot of children, behavior modifications are used to help them understand their behavior and how to address it. There's behavioral parent training for parents to understand how to address how their kids are acting. They learn social skills. There's training for that. Physical activity and sports that can really help kids harness in their ADHD. There's organizational skills training, which is really important for kids. Be able to learn those skills as they're struggling with this disorder. And there's meditation, be able to calm their brain down and quiet their mind so their brain's not going 500 miles per hour. It's a lot more calm. For adults, a lot of cognitive behavioral training and treatment is used. There's relaxation training, which goes hand in hand with meditation. Coaching to teach organization, which is really important in family and work life. There's mentoring to help relationships and family education. So siblings and family members can better understand this disorder. These have been found to be pretty effective, but it depends on the person and how they respond to it. It's different for everybody. This is a really important disorder to be patient and kind with people about as they're trying to figure out how their brain is working and better understand how they can focus and live their life normal. And so I would just ask that everyone is kind and patient again with those who are struggling with this. And I hope you guys enjoyed learning about ADHD. Thanks.